This is to talk about chapters 1 and 4, the principles and goals of public health, and ethical and human rights concerns in global health. And these pertain to our Global Health 101 textbook. So first we're going to define some terms about public health. We're going to describe the core functions of public health, and then we're going to look at key ethical and human rights concerns. The World Health Organization, started right after World War II, defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Global public health, then, is what members of a society do to create conditions in which people can be healthy. So it's what the members of society decide is important for people to be healthy. Sanitation, vaccinations, primary care sites where people can go to be treated. Those are all ideas related to public health. The goal of public health is to organize community efforts that will use scientific and technical knowledge to prevent disease and to promote health. Remember that public health nurses, just as nurses that work in hospitals, are excellent at translating scientific and technical knowledge to individuals and to the community. So the benefits from public health are a dramatic increase in life expectancy, meaning people are living longer, and then also decreases in mortality rates. And mortality rates are the death rates, the rates of people who die. And particularly in the United States, but all over the world, we know that stroke, coronary heart disease, cancer, pneumonia are all major causes of death around the world. So public health nursing is defined as the focus on the health of a community or population by working to preserve, protect, promote, and maintain health. We use the nursing process, which means that we assess, we plan, we implement, and then we evaluate our programs. We assess problems that our community may be having. We look for the strengths of the community and try to work with that to build the community, and we look for their weaknesses. And when we see weaknesses, then we plan programs for the population. We look to find solutions and interventions for problems that the community is having, and then we evaluate the effects of the program. Global health, then, is the study, research, and practice that places priority on improving health and achieving equity in health for all people worldwide. And the core functions of public health are assessment, assurance, and policy development. And so assessment would be data collection. What are the mortality rates, the death rates? What are people dying from? We're monitoring health status. When there's an epidemic, we're looking at how many people are dying from the flu epidemic, how many are being hospitalized, how can we prevent it, how can we keep people informed so that they can prevent getting the flu, so that they can get vaccinations. That's under assessment. Assurance in public health means that the public health providers are giving services and making sure that the public health workforce are competent, that they are correctly educated and always updated on information. We see that we have rising rates of Zika, which means that the public health workforce needed to be notified of how to prevent Zika, how to screen for Zika, and then for people who were found with Zika, how to prevent disability from that. And also assurance means that they're enforcing laws. So they are enforcing those public health laws that say that when a restaurant has food under lamps and on a steam table, there's a certain amount of time before that has to be changed, has to be re-refrigerated. Those are the kinds of laws, air pollution laws and things like that. And then there's policy development, which means the public health people are looking at policies such as the school policy that requires children to be vaccinated to go to school. That's a policy that came out of public health is based in scientific research that says that when a child is vaccinated, there's less likely chance of dying from those communicable diseases. So I want to talk to you a little bit about equality versus equity, and we know that these words come up a lot. I'll show you this picture. This is equality. When you have people of varying sizes, shapes, and needs, and they want to see the game, but there's a fence in their way, if you gave everybody the same box to see the soccer game, it would not meet everybody's needs. However, everybody was equally treated. When you have equity, people get what they need to meet their needs. So the tall person on the left didn't need a box, but the girl in the middle needed 2 boxes, and then the person in the wheelchair needed a ramp. And so when you hear the words equality versus equity, really in public health we're striving for equity, getting people what they need to remain in the community and to remain active in the community. So this is from your book, and these are some of the big global health issues that we are concerned about right now. And I will recommend that you take a lot of time to look at the tables in your book to start to think about, could this affect me? A lot of times an infectious disease is only one plane ride away, and one mosquito bite when you're on a trip in a malaria area. So we as nurses have to be concerned about these global health issues because we are not in a vacuum. We can be affected by microbial resistance, MRSA, and eradication of polio. We are almost on the verge of that, and then HIV and malaria are still issues that we deal with. So we're going to go over in the future determinants of health, the measurement of health status, the importance of culture to health, the global burden of disease on families and communities, key risk factors for different health conditions. And so these are what's going to be coming in the future. But I wanted to mention to you that these are the big concepts of public health nursing. These Sustainable Development Goals, we have 17 now, are put out by the United Nations and the World Health Organization, and if you look at them, you can see how if a country is working on items, then they will have healthier communities. When there's gender equality, communities are stronger. When there's clean water and sanitation, children are not dying from diarrheal diseases. When there's zero hunger, children can grow, adults can maintain their strength. We all need to know that we need a variety of foods to maintain our immunity and to remain strong. And so when a country is looking at these developmental goals, we're hoping that they are putting effort and money towards each of these in order to build strong communities. So the central messages of global health is that we want to make water and air better for the people. We want to have better education. We want to prevent disparities within a country and across countries. And when we talk about our countries, I will be asking you to pick from a list of third world countries to use as your country of that we will use to talk about in discussion boards and in papers. We're going to see the disparity between the healthcare in the United States versus healthcare in Haiti, and we'll see the differences between Bolivia and Peru and Mexico. So now this is a little bit about Chapter 4 and the ethics of public health is rights-based, seeing that people have rights, that there are human rights and they should be protected, and that the nursing code of ethics gives us an ethical obligation to care for people, to protect health, to protect communities, and the Nurse Code of Ethics for Public Health Nursing is in Module 1. We're looking at ethical decision making, and we do this all the time. We think about, is it ethical what this patient is asking me to do? The same as using ethical decision making in our communities. And one of the big concepts of the ethics is the distributive justice. Public health money is very limited, and we need to make sure that the small amount of money that we have is fairly distributed, and that it benefits people to decrease their burden. And so when you have a program that you're planning, if you have a lot of elder people in your community, we know that elders have a lot of need and children have a lot of needs. So how are you going to distribute the money, meeting the needs of young families with young children and meeting the needs of elders who also have services? So public health looks at distributive justice. Advocacy is a big role for nurses. I'm sure you've had advocated for your clients, for your patients, with a doctor, with another nurse, with an institution, with the hospital. And now we're going to talk about advocacy as the role of the public health nurse. And so the public health nurse needs to act in the community's best interest, needs to act in accordance to the group's wishes. So the public health nurse is not going to say, well, I know that you think that crime is a big problem, but I think that cardiac disease is a big problem, and so I'm going to spend all the money on cardiac health, not anything about crime. So the public health nurse has to act in accordance with the group's wishes, meeting their needs and what they consider their priorities for health. The public health nurse needs to keep the group properly informed about decisions that perhaps are coming in from the community council or from the governor. The public health nurse needs to carry out instructions with diligence and competence. When there are flu vaccination programs and other programs, the nurse needs to carry those instructions out competently. The nurse needs to act impartially and offer frank, independent advice, meaning not to join with one group against another, that is going against each other. Again, in an ethical manner, and then also to maintain client confidentiality. So key challenges for public health nursing in the future is the need to train nurses in ethics and in human rights issues, because issues can become clouded, especially when culture plays a role. So we need to be exposed to and trained on ethical rights. And we need to determine the fairness of investment choices, investment in where the money is going towards programs, and then also work to ensure standards of care and quality care and delivery of service. Thank you.